afternoon. My name is Gina Miller. I'm here with a group of students and we're going to talk about how to create a maxillary alginate impression for a patient. We use alginate impressions in dentistry for lots of different reasons. One of the primary reasons is if a patient comes in and they have extensive decay or broken teeth, or we can take an impression of their dentition and create a study model that the dentist can then look at after the patient's no longer there to help analyze his treatment plan. Sometimes when you have an extensive treatment plan, you can't do it at the moment the patient is in the chair. You have to kind of study it, compare the way their teeth bite together, and how you can present to the patient the best restorative options for them. And a lot of times we'll give different options, whether it be they might need some extractions and a partial denture, or they might need some implants to replace some teeth. You know, they might have some teeth that are beyond repair, and that's why we would extract them and maybe use an implant or a partial or a bridge, you know, something to fill in those spaces so that they have a full complement of teeth. So we use those study models to help us decide what the best treatment is for a patient. Additionally, we use study models to create the actual partial denture. We take the impression, see where the missing teeth are, and that goes to the lab, and they use that to fabricate the metal framework or the acrylic framework of the partial or a full denture. We can also use a impression to pour up a model that we can then use to make either custom fit whitening trays or sports mouth guards, or for patients that have clenching or grinding issues while they sleep, we can create a custom night guard that will help protect their teeth from being damaged from the constant abrasion of occluding on them too heavily. The most important thing for you guys to get out of our lesson today in making an alginate is make the impression with a well-mixed impression material. If you leave the material where it's kind of lumpy or bumpy, that will, and you see it in the patient's mouth lumpy and bumpy, that affects the impression that you end up with at the end. So, you know, when we consider the armamentarium we use, of course we use an alginate impression material. We always use a flexible bowl versus a firm bowl, because as we work with our material, we tend to move and squeeze the bowl around to be able to mix it thoroughly. There's lots of different types of spatulas that we use in dentistry. There's a plastic, which is a more flexible, so with this being flexible and the bowl being flexible, you can't get as great of a mix of the product with that. A little skinny spatula like this one will also not be as effective as this is our favorite to use to mix alginate material. It's a metal, so it's a lot stiffer and it works really well. And so when we mix the powder and the water together, we turn the bowl on its side and kind of go back and forth, which is an action called spatulate. This is probably the only time you'll ever use the word spatula as a verb, and we spatulate the product inside there to mix it nicely. We also use, with every alginate impression material, it will come with its own scoop that is the perfect quantity. So, you know, you mix, if you're doing a maxillary, you would do 3 scoops to 3 units of water. At these line marks are the units. If you were doing a mandibular, it would be 2 scoops and 2 units of water. So we use the materials that come with our alginate. You can't just grab any old scoop or any water container, because then you might end up with inaccurate mixes of your product. Okay, so the goal of our exercise today is for my students to learn, one, how to assemble the proper materials, armamentarium we call it in dentistry, to learn how to fluff the material accurately, to measure it properly, which is you fill the scoop and you use your little scooper to get off any excess so that you have a nice level scoop. And then once it's all, you know, the water and the powder are both in here, we have to spatulate it correctly to make the nice smooth consistency before it's placed in the tray to be placed inside the patient's mouth. So, you know, there's a lot of little steps to it, but it seems kind of complicated until you start doing it, but it's a really you do the same procedure on every single alginate impression you're ever going to take, and so over time it becomes very second nature to us. The couple of objectives we're looking for towards the end of this lesson is, one, we want our students to learn how to pick the proper size tray for their patients. So, because not all arches are created equal. A bigger person may have a bigger mouth, therefore a bigger arch, and so they need a tray that's wider. The tray has to cover the arch so that all the teeth are enclosed inside of it when you seat it up in there, and it kind of goes around a couple of millimeters above the maxillary dentition or the mandibular. When you seat a lower tray, the tongue tends to be in the way, so your patient has to lift their tongue and kind of lay it down over the top of the tray in order for that lower tray to correctly get all the dentition. So that's the first objective, pick the right size tray. The second thing is to learn how to fluff the material and measure it correctly. And once you get that in the bowls, then you're going to go ahead and add the water and begin spatulating it as you should, back and forth kind of with a bowl on its side. And that helps to mix it properly. The next thing, our next objective, is to then load the tray. So you would put that material inside the tray. You don't want it piled up really high, because then you've got too much material that's likely to go down the patient's throat a little bit before it starts to set. You don't want too little material, because then you can't capture all the dentition and the palate and the outside buccal areas of the teeth, so. And then the final thing is, once we get all of that, the tray with the material seated inside the mouth, the last objective is to learn how to remove it properly. So we generally stick one finger up inside to sort of pull down to sort of snap the seal, because it will like suction to your palate. And once you are able to snap the seal on one side, you just pull it straight down and out of the mouth, and that helps to not distort the image very much. Sometimes you can tear the alginate material, and if you did that, then you gotta kind of start all over to get a complete impression. Now that we've gone through all that stuff, we're going to try on our tray for our patient and make sure we have the right size, and then we will go on and start to mix our material. I have a volunteer patient here who is going to allow me to fill this nice little tray with some goopy stuff and take an impression of her teeth. So the first thing, we've already discussed in lecture how all the properties of alginate, how it sets up. Their students have mixed it and put it in a tray and taken an impression on a dentiform previously to today. But this will be their introduction to taking it on a real patient that has lips and cheeks and a tongue and all that stuff. So the first thing we're going to do is to ensure that we have the correct size tray. We're going to try it in. So I'm just going to pull her cheeks to the side and slip it in, and I'm going to make sure I've got all the molars, everything fits in there well. Okay, so we know that this is the right size tray. So then we're going to move to our materials. This is an alginate impression material. It's a regular set material, which means you have about 30 seconds to mix it and then about a minute for it to set in the mouth. So does anybody remember why the first thing I did when I picked this up was topple it over? What does that do for us?
Keeps it from settling since it's been in the cabinet.
Settling in the bottom, that's right. So we fluff it a little bit by turning it upside down and right side up again. And we use a scoop to measure. Kind of just overfill and take off any excess. How many scoops does it take for a maxillary tray?
3.
And how many units of water would you use with that? 3. Exactly right. And if we were going to do a mandibular tray?
2.
Okay, 2 and 2. It always matches up. And then the other thing is, I have a canister of tap water that has sat, and to allow it to come to room temperature. Do you remember why we use room temperature water?
It affects the setting time.
That's right. You were exactly right. So since I have 3 scoops of powder, we're going to use 3 units of water. I had actually filled this up just a little bit prior to starting filming, so I didn't have to pump it for so long. So since I've already had my powder in the bowl, I'm going to grab another bowl and just put the water in this first, and then we're going to slowly add the powder. Very slow with it. And I'm going to stir it just a little to start to begin to get it mixed, and then you turn it on the bowl on its side and start to push that material along the side of the bowl to mix it smoothly and get all of the powder mixed into the water correctly. Because when you seed it in the tray, if it's not properly mixed, it'll affect your impression, right? Because we want an exact replica of the tissues inside the mouth. So if you use the side of your tray kind of as a way to scrape some of that excess off. And where she has teeth, it's gonna displace a lot of this material that's inside there, so there's no need to pile it up super high to overfill it, because that extra has to go somewhere, which generally might be down their throat, so we don't want that to happen. I'm dipping my fingers in a little bit of water here to just smooth it across the edge, right? I'm going to hand our patient here some extra gauze, just in case I get this all over her. Okay, so I'm going to ask you to open. Okay, so now I'm going to seat it at the molars first, and then I'm going to push it up to seat it in the front. And I'm just going to hold it. If our water was the correct temperature, this should only take it about a minute or so to set up. The room that we are in is kind of warm, so that can affect the setting time as well. Sometimes taking it longer or making it set up a whole lot faster than we intended. Okay, so now it's starting to get nice and firmly set up. So the best way to remove it from our patient's mouth is to stick one finger sort of towards the side and kind of pull straight down to pop that seal a little bit, and then you can usually tilt it to kind of get it, and then pull it straight down and out. And here's what the inside of the impression looks like. We have a nice amount of tissue all the way above, so that if we were using this to make a whitening tray, we would be able to get it up nice and high over the very front of all of her anterior teeth, or all of her teeth for that matter. So there we go. That's it. That's how you make an impression. Okay, so at the conclusion of taking your impression, you're satisfied with how it turns out. You're just gonna rinse it under running water, kind of shake it out a little bit. We spray it with a bleach water mixture and shake it off a little bit, and it'll go in a Ziploc bag until we can get to the lab to pour up the impression.